Hello everybody, continuing with the first video. Now we'll talk about anion gap and its uses. So at the end of the first video we spoke about how compensation cannot take the pH to normal, it can only tend to normal. So mostly if the pH is normal, there's a third disorder. Apart from the primary disorder and the compensation, there's a third disorder present. Now you can find it by checking the anion gap. So most probably we'll be having a metabolic acidosis kind of a case. So if the anion gap is normal, that is, it is from 10 to 15, so then we'll call it a normal anion gap metabolic acidosis. So that is NAGMA. And then if it is a high anion gap metabolic acidosis, we check the delta gap. This one, check the delta gap. Okay, so if HAGMA, which is high anionic gap metabolic acidosis, has a delta gap of less than 1, we say that HAGMA also has, the person also has HAGMA plus a normal anion gap metabolic acidosis. If the delta gap is 1 to 1.6, we say that the patient has only a pure high anion gap metabolic acidosis. Okay, but if the delta gap is more than 1.6, we say that the patient has HAGMA plus a metabolic alkalosis. I'll just explain why these values turn up. Okay, so let's see here. Now a delta gap is calculated by finding the change in anion gap divided by the change in the bicarbonate. So usually the anion gap in the patient is much more and the bicarbonate in the patient is much less, because we're talking about a high anion gap metabolic acidosis. Okay, so now in this case, delta anion gap would be patient's anion gap minus normal anion gap divided by delta bicarbonate, which is normal bicarbonate minus the patient's bicarbonate. So usually you'll end up with this formula, anion gap, normal anion gap minus 12 divided by 24, which is the normal bicarbonate minus patient's bicarbonate. Now the concept behind it is like this. So in this patient, now if your bicarbonate is low, okay, and you're suspecting a triple disorder, so the third disorder mostly is an acidosis. Now this acidosis, on finding the delta HCO3, will cause an increased delta HCO3. See, 24 minus a smaller number would be a bigger change. So then your delta gap would be less than 1. If you're looking at the alkalosis as a third deformity, then you'll find a higher bicarbonate, which will make delta bicarbonate less and delta gap more than 1.6. So that explains the previous flow chart. Okay, so that explains this. Now we'll move on. I just told you that if the pH is normal, there are other implications. So if the pH is normal and you're sure, and it's come as a question, mostly there is a deformity, so we will look at the anion gap. If the anion gap is high, then there is a metabolic acidosis and you have to investigate further. You have to go as per the equations that we have described earlier. Or if the PCO2 and bicarbonate are both abnormal, then again you have to solve. You have to solve and find out what are the deformities. Okay, now about anion gap, I'll just quickly describe what is the anion gap. Now usually the blood is neutral and the cations in the blood are equal to the anions. Okay, we can measure a few of these substances only. So we can measure the sodium, we can measure chloride, we can measure bicarbonate. The rest, it was found that there was something else. There were other anions present, because sodium, the milliequivalents of sodium were not equaling the milliequivalents of chloride and bicarbonate on checking this equation. So people added another term, unmeasured anions. Okay, now this unmeasured anions can balance this whole equation. So in the body, there are anions which cannot be measured normally, so like albumin and other negative anions. So these are normal, these are present in a small quantity. So that's why the normal anion gap is 10 to 15. It's a small quantity. So sodium is usually balancing the chloride, bicarbonate and unmeasured anions. So normal anion gap would be sodium minus chloride and bicarbonate. Okay, so the normal anion gap is telling you the amount of unmeasured anions that are present. Okay, unmeasured anions in a normal person, or in a person with a disorder, but without affecting the anion gap, or without any addition of extra cations or anions. Now if you see here that if there's an extra cation present with sodium, and this cation and sodium are balancing the negative anions, so then if you subtract sodium from the anions, you'll get a negative anion gap. Okay, because here one cation plus sodium is balancing the rest, so that means sodium has a lesser value, so you'll get a negative anion gap. An example of this would be lithium toxicity. When there's too much of lithium, you'll find a negative anion gap. Now the final case, most important case, is if you have an unmeasured anion, if you have another unmeasured anion, like for example, let's say if you have some lactate, if you have some extra albumin, that extra is what I've depicted here, then the sodium will be more and it will try to balance out the chloride, bicarbonate, normal unmeasured anion plus the extra anion which has been added to the system. So now so sodium will be at a much higher value. Now if you subtract sodium from chloride and bicarbonate, you'll get a high anion gap. So mostly in lactic acidosis, you get a high anion gap acidosis. Okay, so that explains the anion gap, and